understand the mechanism of injury. I'm going to take a look at it. I might see some redness, but probably not. But I'm going to palpate, and I'm going to push right there, and they're going to go, ouch, that hurts. How they're going to describe this is as if they are stepping on a rock. That they'll say that almost every time. It says, geez, it feels like I'm stepping on a rock. And everybody knows what that feeling is like, right? So generally it's going to be in the lateral calcaneal aspect. So the technique we're going to use for acute calcaneal periostitis is simply a basket weave. And we use the 1-inch tape. Even on a smaller foot, you're still going to use the 1-inch tape. You're going to come down to about the midpoint of the arch, and you're going to have them, you're going to spray with tape adherent first. This needs to be very tacky. So again, I think you know this already, but just in case you don't, you spray it, and if you put the tape on right away, it's not going to stick. You have to kind of blow dry it, get it to the point where when you touch, it's tacky. If you don't, it's not going to stick. So it's got to be tacky, about the midpoint of the arch, and then you're going to come just inferior to the medial malleolus. Since I'm being videotaped, I want to make sure that it's perfect. There's no and just inferior to the lateral malleolus. And again, index finger, thumb, snap that tape so that you've got, these are the framework for your basket weave. This is a basket weave technique, and it works entirely on the gate control theory. We're going to apply pressure to a bruised tissue, and it's going to eliminate the pain. Works so well. You're going to look at this, you're going to think, Russ, this isn't going to work at all. I guarantee this works really well. Then you're just going to take and basket weave, half flap your tape, lifting it up, going to the anchors, not tearing beyond the anchors, working your way around half flap.
How tight are you pulling?
Full tension.
Okay.
Half flap your tape, pull it up.
So you're pulling lateral.
Doesn't really matter.
Okay.
It just means that you're pulling it up, that it's being pulled up. Does that make sense? It does matter which direction on a different technique, but on this one it really doesn't matter. So again, it's just a basket weave. I'm just going from anchor to anchor, bringing it around. Now once I get to the cup of the heel, I have to change my angle a little bit. So generally, that was there, and that's going to be okay. I think I can go one more here. And then I got just this little itty bitty gap. Okay. And then I'm going to re-anchor it, just like I started. Inferior malleolus, midpoint approximately of the arch. Close it up, smooth it down in. Okay. That's the basket weave for calcaneal periostitis. Doesn't look like it does much, does it? I'll guarantee, and what the athlete you're going to see this most on is a wide receiver. Generally, they bang the lateral aspects of their heels. We see it. We also see it in baseball with base runners. When you hit the corner of the base with your cleat, baseball cleats generally don't have really good shock absorption capabilities, and so it's that the footwear and then the base, and it just booms. It just, or the other thing we see is anytime in an outside sport where there's sprinkler heads, the round, the sprinkler heads that are round that pop up and that go down flush with the ground, we also see that too, where it just boom, it does that kind of thing. We also see this in long jumpers. Long jumpers where you long jumper where you see this is when they land in the pit and they're wearing the flats because there's no absorption. And if there's a rock or a pebble in the pit, it's going to do this. I have seen it in swimming with the flip turn. Generally, though, if they don't, on the inferior aspect, it tends to be more posterolateral aspect as they do the flip turn. Okay?
Hit the edge of the pool or what?
Hit the edge of the pool on the flip turn, yeah. So that's not very common, by the way. That's, again, what you're going to hear me talk about most often is the epidemiology, which simply means the epidemiology is the,
I don't know. It's been a while.
where'd that come from? Frequency? Yeah, I couldn't tell. It was like God speaking.
Frequency.
The frequency or the incidence of, and there's actually a book. Melinda wrote a chapter in this book on the epidemiology of injury in intercollegiate soccer. So we know this by different sports. So when I give you these kind of results, you might see isolated situations, but I'm going to give you the most frequent situations, and everything is 80%.
I got one in gymnastics.
Yeah.
Doing front flips on the knee.
Yeah, that's
It
another
doesn't move
place.
a lot.
Yeah, okay.
You're not filming right now.
Got one jumping out of a
So,
tree.
now, the key is all tape removal, don't just pull the tape straight off like this. Again, fold the tape back on itself so that you're not lifting. When I pull like this, you can see how I'm lifting the skin out. Fold it back, bringing it off, especially in the heel and in the ball of the foot, this calcaneus, because that's dead skin. I told you the story in intro. I did a tape job for a longitudinal arch, and I did it directly to the skin, and I peeled the skin raw, about 1.5 inches, just ripped it, and he wasn't able to play because of how I removed the tape. Okay? Fold it back on itself. Don't pull it out. Fold it back on itself when you're taping directly to the skin. So important. See, I've done all the dumb things, so you guys don't have
Hopefully.
to. Calcaneal periostitis. Now I'm going to show you 2 longitudinal arch taping techniques.